Welcome to the Check-in Center of Nextic Practice Management. This is going to show a slightly different view of the schedule based off appointment status. So what we're seeing here is our upcoming patients, the patients who are here, completed their visits, and who didn't make their visits, those no-shows. Of course, we can send out no-show reminders to patients and point them to our online scheduling system. But we can also, on this screen, see a lot about the patients before we actually interact with them or as we interact with them. First off, I'm going to call your attention to the top of the screen. We see some basic demographics. We see their appointment history, current balance, insurance, potential copays. And then, if we click on the patient, we'll see their preferred contact information bolded, why they're coming in. And then on the bottom of the screen is going to be various widgets that you can set up. We'll see on the bottom left, those are the forms that they signed online or didn't sign. So in this case, green is good. That means it was signed. The hazard symbol means it was not signed. Real time, what we can do is right from this screen, we can send a text to the patient at time of check-in to say, hey, fill out our forms. Or we can scan a QR code that will point them back to those forms to fill those out. On top of that, we see their insurance information and a green checkbox to say eligibility auto ran and it was good. As a reminder, eligibility runs multiple times prior to we see the patient. Green is good, yellow is questionable, like an invalid date of birth or policy number, and red means that plan is no longer active. We'll see some demographic information, some billing information, and also we can estimate the patient visit. So in this case, I pre-built it out where it pulls in the patient benefits. We can key in a CPT code or 2 or 3, and it will spit out what the estimate of the visit is. So today's visit will cost approximately $300, $326 to be exact. $301 will go to their deductible, $25 for non-covered services. Real time, we can preview this out. We can hand this to the patient most importantly, and this handles the need for a good faith estimate that some of our offices are providing today. It'll look something like this. Last but not least, not only can this be used for check-in, but it could also be used for check-out. Most importantly is that when I complete this patient's visit, it will prompt me the follow-up plan of what to schedule for the patient next. This plan comes from the clinical side, comes from a clinician. In this case, it's saying, hey, we need to see the patient in 6 months' time. Real time, you can hit the scheduling button. What it will do is pull open that provider's schedule 6 months in advance, because that's when the follow-up calls for it. And then when we go to book the appointment, it's going to copy all the notes and paste it directly into our appointment window. So this way our checkout team does not have to worry about anything.